Over a fifth of Montreal's population has a mother tongue other than English or French, and this presents a challenge when they seek access to healthcare in our hospitals. All too often, requests for interpreters outnumber interpreter availabilities. Medcom's co-founder, Kenzie Abdi Hamid, here with us today, identified this disparity as a medical student and decided to directly address this issue by creating Medcom with co-founders Ellen Chow and Jenny G. Medcom is actively building a mobile platform through which multilingual healthcare trainees can connect with allophone patients to provide confidential medical interpretation during hospital visits. Since its creation in 2019, Medcom has made leaps and bounds towards this goal and has moved beyond simply building a platform to conducting research to optimize their translation services, publishing reviews on the use of medical interpretation in healthcare, launching a medical interpretation workshop series, and advocating for the incorporation of cultural and linguistic sensitivity training into the medical curriculum. Just last month, they received an award of $30,000 from Dialogue McGill for the purpose of improving healthcare access for linguistic minorities. They are truly an inspiring and powerful collective, and I am thrilled to be speaking today with Kenzie Abdi Hamid and Daria Nemova, sitting co-presidents of Medcom and McGill medical students. So without further ado, let's go to my conversation with Daria and Kenzie.
So to start off, maybe you can tell us a little bit about where your passion for language barriers comes from.
Yeah, sure, of course. So I think I would like to start off by saying that I am originally from Egypt. So I'm originally from Egypt. I lived in Lebanon prior to immigrating to Quebec City at the age of 10. When I first came to Quebec City, I was a non-francophone. However, I was a bright kid and I loved school. And that's something that I faced very early on, at the issue of language barriers in Quebec, not being able to communicate with my classmates and teachers in French. So ultimately, I think that's where it all started, I would say. However, then when I came into the healthcare system, you immediately see it. You can ask any student that goes into the clinical setting. We see a lot of patients that have language barriers. I think that's the beauty of Montreal, is that we're so ridiculously diverse, but ultimately a lot of people don't speak French or English. And that can be particularly problematic in the healthcare setting, especially when there's also the issue of health literacy. But I do have to say, I guess my passion comes from my own experience, and then also till now, like my family, when they'll speak to me, they still live in Quebec City, and they'll speak to me about not being able to access certain services because everything's just available in French, and that really, like, it bothers me, I guess. And as a medical student, I found that I'm able to address those issues in the healthcare setting.
So my passion for language barriers similarly comes from an immigration experience. I came to Canada for my undergraduate degree, but differently from Kenzie, actually my first language barrier was English. Even though I was in Montreal and Quebec, having chosen to go to school in English, my first experience with language barriers was there. And you sort of never forget how you feel when you don't understand, or the little details slip through around you in conversations or in important information, such as in the healthcare setting. And having like mastered English and overcome language barriers, I could always reflect back and see what a difference and how much more difficult it was to not be able to communicate properly and express yourself well. And then I had an opportunity to interpret for a family, a Ukrainian-speaking family in the healthcare setting, and having followed them through several complicated appointments with many, many healthcare professionals, I saw what a difference it makes to have someone help you and translate if you're not perfectly fluent in the language of a healthcare professional. So from there on, sort of started my journey, my interest in language barriers. I worked as an interpreter at the Montreal Children's Hospital. And then after getting into medical school, I was excited to learn about Medcom and joined the team to really promote solutions for language barriers.
Right. I think Daria and I, what we share is our passion kind of comes from a deep sense of empathy, which I think is what really drives us.
I thought I'd dive in next with your direct experiences as translators and co-presidents of Medcom. You've probably been exposed to many situations where linguistic barriers present a hindrance. Daria, you just talked about your experience as an interpreter before you joined Medcom. And you've even held an event discussing and highlighting these issues with other healthcare professionals. What would you say are the major consequences of this barrier for the patient if you were to explain this to someone who had just been exposed to this issue?
Right. So I think I first like to start by saying how, I mean, the core of good care, in my opinion, and what we've been taught in medical school is being able to build a therapeutic alliance with the patient, so the patient-doctor relationship. And we study how important, language in medicine is, using the right language, making the patient comfortable, understanding where they're coming from, etc., and giving them that room to express themselves. And I think ultimately that's all lost when there's a language barrier. And it's something that I have faced as a student, facing patients that I can't communicate with. It's like I can't build that alliance with them. It's difficult to understand what the problem is. It's difficult to, and we can find ways around that and finding out what the problem is, but it's difficult to build that relationship, which can lead to consequences in that end, and really like that access to care and access to a good doctor-patient relationship. So that's what I would highlight in terms of the major consequence. However, I think Daria can also share with us some actual practical consequences in terms of health outcomes as well.
Mm-hmm. So there's actually quite a bit of literature on the consequences of language barriers. And while we don't have qualitative aspects, so numbers and prevalences, we do know what kind of outcomes these patients experience. And so first and foremost, there's delay in seeking care. If you can't communicate with your healthcare provider, if you don't understand how the system works, you're less likely to go and ask for services and to access healthcare. And what this leads to is delayed in diagnosis and often presentation to the emergency room where things are more serious and more urgent. Then, like Kenzie mentioned, that disruption in that therapeutic alliance, not being able to properly assess the patient because you can't ask them the history of their medical condition or the situation that brings them into the emergency room. Not being able to do that leads to misdiagnosis, leads to medical errors and over interventions. So you're probably going to try to, you're more likely to use scans and imaging. You're more likely to do blood work to get some objective nonverbal answers to your questions. You're more likely to admit the patient as a precaution because you don't know exactly what's causing their problem. All of this could be rectified by the use of a communication tool such as an interpreter. We also know that patients with language barriers have longer hospitalizations for all the similar reasons already mentioned. And as a result of it, a very frustrating experience with the healthcare, which perpetuates the cycle. So you're less likely to seek care again. I think sort of basic medical education comes in as well. If you don't know to exercise or report certain symptoms, or if you don't understand the link between your diet and diabetes, and it can never be properly explained to you by your healthcare professional because you don't speak their language, all of that sort of comes into pictures and affects worse outcomes in patients with language barriers. I say that every rotation that I go through, I encounter at least one like very memorable and teachable case of language barriers. So one I'm going to share was from my psychiatry rotation. And so this was a patient who's been, when I met him, has been hospitalized for 6 months. And part of it was the seriousness of his condition, but another part was the fact that he would only be evaluated every 2 weeks. And at first I thought that was weird, but upon investigation, I realized that he was only evaluated when a certain member of the team was present who spoke his language. So as a result, this man went for 14 days not being able to speak to anyone in his first language in the psychiatric unit. That's by itself would worsen your mental status and your mental health and your experience in the healthcare system. So sort of that story always sticks to me as an example of unnecessary prolonged hospitalization as a result of not being able to communicate to your team.
And you've written about this before. You have a review on the effect of medical interpretation, whether online or in person, on patient satisfaction. And since you've brought this service into the world, Medcom and your interpretation services, what's been the feedback that you receive from patients and other doctors in the healthcare community?
Medcom in the healthcare setting, it's still being presented, it's still being introduced into the system, I would say. However, like the feedback that we've gotten generally has been just wonderful. Anybody that kind of hears about us, they're so happy that something like this even exists, or there's a potential that something like this exists, because of the huge gap. And often, like, very randomly, I'll have someone, message me, oh, like, I heard of Medcom, like, do you have a student that can interpret for us? And I'm so happy that they heard of us, but like, we don't even try to advertise it this much, because we haven't grown enough, and we don't find that we're sustainable enough to offer that. But they'll reach out because there's nothing else available, and so it's very well received in that end. Any doctor will be very excited to hear about it, especially especially like feedback that I've gotten very positively was from like family medicine and psychiatry, where the history and needing to speak to the patient is so important. In terms of students, I was so amazed by how well received it was as well. Like when I first kind of brought up that concept, and I asked my friends and people around me, oh, would you be willing to be volunteers, and speak the third language that you speak and help patients? Everybody volunteered. We got over 140 volunteers early on. When we offered the training in the summer regarding like how to be an interpreter, we had 70 people sign up to train with us, and they showed up, and it was completely voluntary on their end. We had no real initiative, like incentive, I mean, sorry. And so that was really well received. I think it kind of shows that students from different backgrounds that speak a third language are so willing to help, for, either because they've seen people experience language barriers, or either because they just, they want to offer what they can with their language skills. Um, but there is some hesitancy regarding the service as well. We've gotten some hesitancy from the faculty level, where, what about medical liability? Like, or what about like, if students interpret in a poor manner, or there's errors that are made, what are the consequences there? Doctors can be hesitant because, they say, it's this the medical student's role? Aren't we taking away from their time? How feasible is this? Like, is this really what they're medical students? They probably have other responsibilities. And then from a medical student level, they're always so willing to help, but they're so hesitant in terms of their language skills. Like, am I good enough? What if I don't know a certain word? And that's the trickier part. But I think the highlight here is that there's a gap. Can be part of the solution till there's a more permanent, obviously better solution where professional interpreters can be used. So there's a gap. It's well received, but there is a certain hesitancy.
That's exactly why we have training, because speaking a third language is not enough to be able to serve as a medical interpreter, and we recognize that early on. And that's our training on, and that's why our training on how to be a medical interpreter really tackles that part more than anything. Because if you were to get a sort of formal certification in medical interpretation, most of that training is actually medical vocabulary, something that we don't need to teach medical students. But what you do need to teach them is the ethics of interpretation, where to sit, how to speak, where to look, what are your responsibilities and roles, and how to tackle sensitive, complicated situations. So that's what our training tackles. And then based on the feedback from the medical students on the hesitancy around specific vocabulary in different languages, we're developing a new series of workshops on the basic terminologies in the top spoken languages among medical students.
Right, and just finish off on that. So I started off by saying how the service is still being introduced. The reason why I say that is because our official goal is to build an app or a website, or sort of like an online platform where you can recruit students to offer the interpretation service. And part of the evaluation process that we're going to do with that is also evaluate, are students responding? Do they have the time? How is this received? And have more objective measures on that, which I think is the important part of, doing research around this area as well, because it's so new.
And you've launched research projects with a researcher at the Jewish General and also at the MUHC elsewhere. So since you've started in 2019, I mean, it's really it's really branched off into many different projects. And with this recent award that you've gotten, I mean, I'm sure you have a lot in store ahead. Did you expect it to go in this direction when you started?
I definitely did not. I personally started off, I want to say a little naive, maybe optimistic, but naive, thinking, you know what, so simple. You know, we have a group of students that speak many languages, we have people that need interpretation services. Why not just connect the dots? And that was, I mean, that was the idea, and that's where the idea of the app came about. But then there's all these things that kind of came up. Okay, students need training. Oh, students aren't comfortable in their languages. Oh, can we actually, how can we prove that this is going to work? How can we get funding for this? How, and this is where all the research came from. You know, I didn't think that we would do so much research and advocacy work, but I realized that that's what's needed. Before coming up with a solution, you kind of need to find the problem and then kind of trace your way to the better and best solution possible. And yeah, no, I've been extremely proud of how far it's come, but I did not expect all this to come out of it, for sure.
And I think it's important to highlight that we really stepped up to the task, though. We didn't have to do any research. We didn't have to host so many workshops. We didn't have to train medical students. But I think with every gap, every next gap that we identify, we take it on as a new challenge and develop a new project around it. I joke sometimes that every conversation I have with Kenzie leads to a research project. And that's only a good thing. And I think that also reflected in the growth of our team. We now have a team of 13 execs with a whole team dedicated to research. We also started doing a lot of advocacy work. So we realized, our research, that's great, but we also need to alert sort of the government and the universities and the healthcare institutions on what we're doing and on the issue. And so we have a whole team that dedicated to doing to exploring the landscape of language barriers in Montreal, existing solutions and gaps, and making suggestions of how that could be addressed. And what coming out of that is a position paper that's going to be shared shortly with both universities, medical schools in Montreal, McGill, and UDM, as well as with the government and the healthcare institutions. So really research, advocacy, training, and hopefully a Medcom platform very soon.
I know you're very much in the process of developing that platform and getting a research team behind it and optimizing it behind the scenes. And if you had the influence, it seems like you're already, this is already very much well in the works. But if you had the influence to change the medical curriculum to incorporate this cultural sensitivity and language sensitivity training, what exactly would you like to see change or included?
I think if I could start with answering the language part of it. So because that's the bulk of the training that we've been doing and developing. So when we developed and ran the workshop on medical interpretation, so the structure of our workshop was in 1 hour didactic lecture, sort of teaching multilingual medical students on the basics of medical interpretation. But then that was followed by 1 hour of role plays. In which we really made an effort to group people based on the languages they speak. So at any given time, the role play would consist of a patient and an interpreter who speaks the same language other than English or French, and a third student who would play the physician and would basically not be able to communicate with the patient in any way other than through the interpreter. And it had the advantage of everyone had an opportunity to practice what they just learned in the theory part of the workshop. But every student who played a physician gave us feedback that they've sort of had an eye-opening experience of what it's like to try to do a history with someone who does not speak your language and having to rely on a third person. And all those students realized that you need to receive some kind of teaching in order to adjust your regular history taking and the regular conversations that you have with patients. Because your regular 15-minute appointment now is cut in half or even in 3 parts, because has to be a delay in interpreter translating back and forth. You have to shorten your sentences. You have to take longer pauses. You have to really decide what are the most high yield questions that you're going to ask, given the limited time and the delay that's introduced with an interpretation. And if you don't teach healthcare professionals about this, if you don't set the proper expectations, that leads to a lot of frustrations. When I learned that worked as an interpreter, I have several occasions been asked, oh, why are you here? It's so much longer with you in here. Do we really need you? Can't I just, it seems that they understand a little bit of the language. Can't I just figure it out? But what the healthcare professional might not realize is that without an interpreter, it might appear that you're having a conversation. It might appear that the patient is nodding along as if they're understanding, but the communication is interrupted and the appointment and the health outcome is worse off if you don't use a professional interpreter. If I step back to what we think, what kind of training needs to be introduced, we really think that every medical student and healthcare, other healthcare professional students have to be taught about language barriers, because it's a real issue and a very prevalent issue in our healthcare system. They have to be taught on what are the types of resources that are available, why using family members and intercom announcement volunteers is not appropriate. Why should everyone know or make an effort to learn what are interpretation services available to you at any given institution? So I think those are important learning points, as well as what do you do when you do have an interpreter? How do you adjust your interaction? Why and how it changes? And what can you do as a healthcare professional to accommodate your patients with language barriers? And I think this teaching needs to start early in medical school. And we're hoping to work very closely with the faculty to incorporate some of our experience and some of our workshops into the curriculum.
Right. So there was a two-part to your question. We talked about language sensitivity and cultural sensitivity. I think that in terms of cultural sensitivity, I've thought a lot about that. And recently there has been a lot of talk on how do you teach cultural competency? How can you become culturally competent? What does that even mean? What I prefer and what's also been a little bit integrated into curriculum already is cultural safety training. So how do you approach someone from a different culture and allow for a safe space for them to express themselves and then come to some mutual understanding? And I think that that's really important. It's done a bit, definitely. And I think that there's a lot more talk now. There's a lot of revamping into the curriculum to include more. What I think I would love to see, I don't know if it's realistic, I don't know if it's practical, but just in general, having students present their own stories. So I'll explain myself. So we are a ridiculously diverse group of students, and I'm so proud of that. And McGill is so proud of that. You know, we're a medical cohort that is so diverse. I think that we have a lot to bring to the table. And I would love to learn from my colleagues about their stories, about their heritage, about their culture. And I'd love to teach, myself. And being able to do that, I think, would be really powerful and really give you a lot of insight that you wouldn't get otherwise. And I think maybe in small group sessions or whatnot, I think that would be really valuable. And that's what I would love to see that integrated somehow, very informally, but more formally, I'm not sure. But I think that would be really nice.
I just want to add that our cohorts are diverse, and I think it's important that they continue to be diverse. So continuous recruitment of diverse representations of our population in Montreal and in Quebec is very, very important, because that's really the only way. Like Kenzie said, all the best and most valuable lessons about other cultures I've learned not in the classroom, but from friends and colleagues. And I think the same happens in the clinic. You need to have diverse group of healthcare professionals in order to attract and make comfortable your diverse patients.
Definitely. That sounds like a great future direction. And already right now there's so much diversity, and all the medical students learn from each other. And on the topic of language sensitivity, I didn't know that there were all of these nuances to interpretation, and it's definitely important for a provider to be aware of the difficulties for the patient and for an interpreter to be in the room, because not all the time can a close family member or a friend be in there, because I mean it's sensitive information, it's confidential. There's some privacy that can't really be breached by even a family member. So it's very important to take all of that into account. And I'm really, really glad that you're doing that in your work. And with all of these projects and this recent award that you've gotten, which is amazing. What does the future? What do you have planned for the future of Medcom?
So we plan on running the workshop on how to be a medical interpreter again this summer to a wider cohort of medical students as well as medical residents. Um, then we're also developing a workshop on how to interact with an interpreter. So this would target not just only multilingual students, but any medical student. And what we also would like to do is to spread all of our workshops and activities to other healthcare programs, so nursing students, speech language pathology students, physiotherapy, occupational therapy, because again, this line of work and this training is relevant for any healthcare training. We also would like to recruit we'll continue recruiting volunteers to serve as interpreters and providing them with adequate training. By the next fall, we hope to launch the first version of our Medcom platform, which would allow healthcare professionals to request our volunteering interpreters, either for in-person appointments or over the phone. In the spirit of research work, running research studies to evaluate how well the platform is working and the measuring satisfaction among both the student volunteers and healthcare professionals. And then continuing our advocacy work. So we presented, our team has presented motions at both the UDM and McGill General Assemblies at the student level, and both student societies are supporting our line of advocacy work on promoting language barriers as an important issue in medical curriculum education. And so we look forward to working closely with the faculties to introduce appropriate training into the curriculum.
That's pretty much all of it. I think that the hope here is that we continue to raise awareness. I think that's key. And all while doing that, doing advocacy work, doing research. And we keep saying research. And I think ultimately what we're trying to say by that is just giving evidence to, language barriers and evidence to the solutions. That's something that we do just to be able to reach the goal of raising awareness and advocating. And we hope to continue doing that, in whatever form it takes. I think our most exciting project is really our platform that we'll be launching in the fall, alongside, all the workshops to help it work nicely. And then the advocacy work, I don't know how far that's going to go. I hope it goes super far. We're presenting a position paper to the IFMSA, which is the International Federation of Medical Students Association. That would be very interesting to see it go on a more maybe governmental level as well.
And I would just like to add that our research work currently is supported by the HSALM grant from Dialogue McGill, which is a federal grant from Health Canada. So we're very proud and very excited to have received this funding.
But yeah, something that I've loved with Medcom, honestly, you're asking what the future holds. So many of our projects have just kind of come up because opportunities have arose and because we were able to collaborate. I'm super excited for what can come next, honestly.
Certainly a force to be reckoned with. So where can people find you and support you on your journey and keep up with you as you continue on these many different projects?
Yeah, I think you could always find us on Facebook. We're called Medcom Medical Interpretation. So we regularly follow updates there, and you can message us directly. And we're always looking for collaborations. So if in our goal to spread Medcom initiative to other healthcare professions and other healthcare trainees, I think the best way to do that is having students from other healthcare programs sort of join our team and then introduced Medcom workshops to their colleagues. Because one of the reasons why I think our initiative is so successful is because we understand medical students really well, because we are medical students, we understand availabilities, we understand what works and doesn't in terms of training, the timing for workshops, the format of the workshops. It would be very hard for us to do that for nursing students or social work students without having a nursing student or a social work student involved. So if you are from other healthcare professions or other healthcare programs and are interested in sort of spreading training on language barriers in among your colleagues, you can always reach out to us. We're looking for collaborations. I'm happy to give my email, and I could be reached out to as well that way. On Facebook, our name is Medcom Medical Interpretation, as well as on Twitter at Medcom McGill, at Medcom McGill. Our volunteering database includes 92 students from all years of the cohort of the McGill Medical Schools, speaking 25 languages, languages and dialects. So quite a huge, sort of powerful cohort of volunteers. And I think the numbers are only increasing every year with the increasing diversity of the cohorts, which is great, but very important that it continues.
And that is our show. Thanks again to Daria and Kenzie for speaking with me today, and thanks to everyone listening for your attention. All of Medcom's contact information is linked in the show notes, so if you're interested in what they do or want to work with them, feel free to reach out like Daria mentioned. Also, a very special shout out to Global Health Programs at McGill for helping us bring this about. If you've enjoyed this episode of our Immigrant Health podcast series, make sure to check out our other segments and stay tuned for lots more to come from Reimagining Global Health.